Bev, can you give us the confirmation that we're live at some stage or someone?
Okay, thank you.
Move on to the minutes, Chair.
Yeah, we're live now.
Thank you.
Are we live, Beverly? Yeah.
Yes, we're live now, Chair.
Okay. Good morning, everybody. I hope you can hear me clear.
Yes, good morning.
Gower Almus, and I'm the chair for the Community Safety Committee. Good morning to everybody, and welcome you all and public who are watching us to the Community Safety Committee meeting today. The whole session is going live, so may I just remind all the members to kindly put their mics on mute whilst the presentation is going on, because it just helps with the clear voice to the rest of the public and the members as well. However, if you're asking a question, I would actually encourage you to kindly, not only unmute your mic before you wish to ask the question and use the hands up option on computer, but also switch on your camera as well when you are asking a question. Is that okay with everybody? So if that's okay, I would start. Before I start the item 1, do we have any apologies at all for today's meeting? I know there's a couple of apologies already.
Yes, apologies have been received from Councillor Austin, Councillor Tate, and also from the Chief Fire Officer. Okay,
thank you, Beverly. May I also thank the substitutes, which is Councillor Ron Graham and Councillor Angela Wenham, who have very kindly stepped up to in place of the councillors who've sent their apologies. So thank you very much for attending today's meeting and joining us. So yeah, agenda item 1, minutes of the last meeting, which was held on the 24th of July, 2020. Seems like ages to be 24th of July.
Could I go to item?
Can I move them, Chair?
Are we all happy with that?
Move them, Chair. Yeah.
Yeah. Okay. Thank you. If that's the case, any matters arising? Ron, you wanted to ask something?
Yes, please, Chair. Item 219, item 6, performance management information outcome targets. If you go down to the bullet points, right. The first bullet point on the page is water safety and possible recommendations to Yorkshire Water. I would like to see a report made out by Yorkshire Water Chair that identifies the pollution that our officers and the public are put at danger to as regarding the pollution. Now that COVID-19 has been identified as a possible cause of pollution, we need a report from Yorkshire Water Authority, Chair, that gives us the information just what pollution is occurring in the canals and rivers in our area.
Thank you, Councillor Graham. Are you referring to the sewage system? Is that your referring to?
It is part and parcel of the pollution that sewage is now being identified as a carrier of COVID-19, Chair. Yes. Okay.
And would you like some explanation on that, or what would you like?
I'd like a report from Yorkshire Water Authority for the benefit of us all, Chair, as the members of the Fire Authority and members of the public.
In the next meeting, yeah?
Please.
Okay, thank you. That's been noted, I'm sure. Any other matters arising from the minutes from last meeting?
Chair, it's Dave Walton. Would you be okay if I gave a short response to Councillor Graham? I think it's appropriate to do so.
Please, yeah.
What I'll say is we'll make approaches to Yorkshire Water. Certainly it's not within my gift to promise a response from them, but we will speak to them. But what I would also say is that the PPE that our crews would wear if working in and around sewage outlets or sewage, etc., is appropriate for the risk to which they would be exposed. Equally, for those water courses where crews are working or training in water, then quite routinely water quality testing is something that we take very seriously to make sure that the water quality is good. Clearly, you know, we wouldn't work in fast-flowing water immediately after a storm because it's likely to have washed stuff off the fields, etc. So, noting the point, we will speak to Yorkshire Water about general water quality issues, but hopefully that's an update as to where we're at with that.
Okay, thank you, Chair. Thank you, David.
Councillor Graham, could you move the camera to the centre because we can see side of your face? Yeah, that's thank you, Councillor Graham. Okay, anything else at all? Any matters arising? No? Any urgent items? I don't see any urgent items, but are there any urgent items that we need to deal with at this point? Not. Item 4, which is admissions to the public. Any admissions at all to the public? Not. Any declarations of interest? To consider any declaration of disclosable pecuniary interest in relation to any items of the business on the agenda today? Anything at all?
No, Chair, no.
Okay, thank you. If not, I'd like to move on to item 6, page 9, which is the quality of service survey, and that's been presented by Alison Davey. So over to you, Alison, please.
Thank you, Chair. This is to give members an update on the quality of service surveys which are carried out during the year. We carry out 3 different surveys, and I'll go through the results of each of those separately. So the first one is the after the incident survey, and we send out a survey to incidents that we've attended, randomly selected the month after the incident. So during the year, we sent out 644 questionnaires to domestic incidents, and we had a response rate of 20%. We had 132 that responded. For non-domestic, we sent out 277, and we had 64 that responded, which is a 23% response rate. The data for the year 2019-20 only covers the period from April 19 to January 2020, as the COVID lockdown prevented surveys being sent in February and March. So it's for 10 months rather than the normal 12 months. The questionnaire is very detailed, and it gives questions regarding the full customer journey from the initial call through to our control centre to any follow-up actions that have been carried out and actually at the incident to get satisfaction levels across the board. So it asks questions regarding satisfaction with the initial contact made with the fire service, the service provided at the scene, information and advice given, and follow-up contacts from the fire service after the incident, and provides us with overall satisfaction with the service. So as a summary, on page 15 at paragraph 2, for domestic incidents, 97% of the respondents said that they were very satisfied or fairly satisfied with the initial contact with the fire service over the telephone. 51% said that the fire service arrived at the incident quicker than expected, and 39% said the arrival time was as they had expected. 98% of the respondents said they were very satisfied or fairly satisfied with the service provided at the scene, and 97% of respondents felt that the service kept the effects of the incidents to a minimum. 81% of the respondents received fire safety information at the scene, and overall 98% of the respondents expressed satisfaction with the service that they'd received. Moving on to domestic incidents at paragraph 3, 97% of the respondents said that they were satisfied or fairly satisfied with their initial contact with the fire service. 31% said that the fire service arrived at the incident quicker than expected, and 60% said the arrival time was as they had expected. 96% of respondents felt that the service kept the effects of the incidents to a minimum. 100% of respondents said they were very satisfied or fairly satisfied with the service provided at the scene. 70% of respondents received fire safety information at the scene, and 20% received an advice booklet. And overall, 98% of respondents said that they were satisfied with the service that they had received. Moving on to paragraph 5, it gives a breakdown of each of the indicators that are included within the questionnaire and provides a comparison with the previous year. So that's over the next few pages. Moving on to section 6 on page 20, we've provided a full breakdown of the profile of all those respondents. And there's nothing in there to suggest that any particular groups within West Yorkshire are receiving any less service than others. So that's very good. Moving on to page 21, paragraph 7. This gives the breakdown of each of the indicators regarding the non-domestic questions and a comparison with the previous year. On page 24, paragraph 8, we have benchmarked ourselves against other fire and rescue services who use these particular questionnaires. Each of the satisfaction indicators is allocated a score from 1 to 100 and benchmarked with those fire and rescue services. So although some of those indicators may not be in the top rankings, the scores are still very high for the satisfaction levels. And just to give you an example of that, comparison with the other fire and rescue services who carry out these surveys, on the indicator satisfaction with initial contact with the service, the national top score for that was 98 and we received 97. So you can see that the scores are very close to each other. So where it says that we're not first ranking on some of those indicators, it isn't really significant. The benchmarking is less useful when it's not a national picture of all of the fire and rescue services. And as I say, this is just comparing ourselves with 5 or 6 of those fire and rescue services within the country. Just going on to a few comments that have been made alongside these questionnaires. For domestic incidents, just to pick out a few comments for members. A comment from one of our customers was, everything was done extremely quickly and efficiently, and every firefighter was superb to deal with. Can't praise them highly enough. Another comment was, everything was first class. The crew were exceptional. I live alone and they were great. And another example, keeping me calm and taking control of the situation well. So we've got some very positive comments there regarding domestic incidents. Moving on to the non-domestic incidents, just a few comments from those questionnaires. Arrived quickly and addressed the situation very professionally. Fast, efficient, professional and authoritative, thereby giving everyone confidence. Kept us informed and the investigating officer was very thorough. So we've got some very positive comments there. Moving on to the Safe and Well visit. This is a new survey that we put together for this year, 2019-20. Which reflects the new Safe and Well visits that we carry out rather than the previous home fire safety check. So the new form, we put this together with the company that we work with on these questionnaires, which is Opinion Research Services. So we put this questionnaire together for them and with them and have made this questionnaire available for other fire and rescue services to use should they wish to do so. So we had 483 completed questionnaires during the year. We sent out 1,375 during the year, and we had a response rate of 35%, which is a very good response rate. So this compares with the previous year when we sent out 1,500 and we had a response rate of 36%. And it differs due to only 11 months being completed here due to COVID. We were unable to send out any questionnaires in March this year. Again, the questionnaire covers a number of topics, from the initial contact with the fire service, the Safe and Well visit itself, after the visit, how did we do, and information and questions regarding the individuals. So overall, the initial contact respondents were 100% satisfied with the initial contact with the service. The pre-arranged appointments were given to 76% of respondents, and of those, 97% of the visits took place as arranged. 3 of them arrived late and apologised for that, but there was no indication that any of the appointments were not kept. At page 31, paragraph 4, there's information there regarding the information that was provided to residents during the Safe and Well visit, and we've given advice across a wide range of areas, which is shown in the table on the top of page 31. The table at the bottom of page 31 goes on to other areas of information that we've provided to occupants to keep them safe in their home regarding slips, trips, falls, cessation of smoking, etc. So we're covering a number of different areas there, not just fire related. Since the Safe and Well visits, 45% of the respondents said that they now check their smoke alarms weekly. So again, that's encouraging that they are making those changes and checking those things. And they've also made other changes which are highlighted in paragraph 5 on page 32 regarding cleaning the smoke alarm regularly, closing doors, leaving door keys in an accessible place at night, etc. So taking everything into account, 98% of respondents were satisfied with the Safe and Well visit. On page 33, we've given a breakdown of the profile of all of those respondents as well. And again, we can see that there's no lesser service provided to any particular groups. Just picking out a few comments again from the responses. One of them had commented that they do not put too much oil in their chip pan now, so that's good, and hopefully that will keep them safe. Another comment is, I do not leave my mobile phone charging during the night. And another comment, my autistic son is now our family fire warden. He has been shown how to clean, test, and reminds me every Saturday to check the batteries in the smoke alarm. So that's all very good as well. Then moving on to the school fire safety visit survey. Now we only had 26 completed questionnaires. These are provided to the teachers electronically after the school talk, but we only had terms 1 and 2 during the year 19 to 20. That was lower than the previous year, and that was due to the COVID lockdown, which stopped any talks being delivered during term 3 and prevented any responses to those talks delivered as they weren't delivered in February and March. So it's a lower response rate there, unfortunately. The questionnaire covers lots of topics about the topics that they covered during the talk, the materials that they use, the pupils and how they engaged with the fire officers, how the presenters engaged with the pupils, was the length of the visit appropriate, and was the appointment kept on time, etc. The overall satisfaction was 96% of respondents were satisfied with that school fire safety visit. And then we do ask, do they do any follow-up actions after the visit? And on page 39, there's some information there about follow-up, which the school did after the visit. And there's some comments there regarding how the visit went. For example, the firefighters that delivered the talk were very good with the class. It was very informative. Thank you for visiting. So those are the 3 surveys that we carry out on a regular basis during the year. It is positive, and like I said, there are comparisons there with the previous year. Happy to take any questions, Chair.
Thank you, Alison. I can see. Is that Councillor Richard?
Yes, yeah, Councillor Hunt here, Chair.
Yeah, sorry, I could just see your first name on the screen, Councillor.
Yeah,
but,
no, that's fine.
Yes, please. But may I ask? Yeah, it's good that I can see you on screen, but I can't see everybody else on screen. So if you have a question, please raise your hand as such, which is on screen. So in that way, no, on the actual screen, what I mean is, we've got the facility where you can actually click online, and then I'd be able to see there whose hand is up. Yeah. Otherwise, I might miss you, and I don't want to do that. Yes, please, Councillor Hunt, please.
No, it's with the schools actually. Do the schools request the visit, or are they selected? And how are they selected for a visit?
Thank you. Alison, would you like to answer to that, please?
Perhaps one of our operational officers would like to say how those are carried out.
Please, yeah, the criteria.
Hello, Councillor Hunt. It's Scott Donegan. Every Year 5 school in West Yorkshire is contacted and offered a fire safety visit, which covers a whole range of issues, including road safety, safety in the home, information about antisocial behaviour. So that's our primary approach, to make sure we get every child of that age across the county. Additionally, we do look at schools in higher risk areas to give them more involved interventions. So it's a bit of a two-pronged approach to that.
Thank you. And before I go to the next question, which is by Councillor Harrand, I'd like to first of all thank you, Alison, for a wonderful report. I'm really impressed by the numbers and the response rate going up by 3% and 5% for domestic and non-domestic customers and domestic residents and so on. Could you just kind of elaborate a little bit on how we achieved this good success? I mean, 5% increase is quite a significant increase in terms of getting the returns of the service done. So I'm really pleased with that. How did we do that, Alison, quickly, before I ask Councillor Heron to ask the question, please?
Okay, yes, thank you, Chair. What we've done this year is we've tried to send out as many questionnaires as we possibly can. We don't send them out to anybody who we would cause other further upset to. So we will look at those particular ones, and if we feel that it might cause them further upset, for example, if there's been a fire death due to the incident, then we wouldn't send them a questionnaire. But like I say, we have sent out as many as we possibly can to encourage a higher response rate. And I think, like you say, it's very positive, you know, due to the situation that we've all been in as well. So it's very encouraging that we've got those responses through. It gives us information that we can work on to look at how we need to improve our service moving forward.
Thank you, Alison. Thank you for that response. I'm really pleased with that. Yes, please. Next is Councillor Peter Heron. Thanks a lot for your patience. Councillor Heron, please.
I want to say I've been patient now. On 8.1 domestic incidents, please, can somebody send us a breakdown that with a bit more detail? There are 24 indicators, and half of them were below halfway. We're third place or below third place. And I don't need the explanation now, but if somebody could tell us on which, confidentially if you wish, on which we are 4th, 5th and 6th in this table of 6 authorities. I think that might be useful for us, but I understand if you don't want it to be public knowledge. But telling us that 2nd or 3rd with 5 and 4th, 5th and 6th with 19 just prompts more questions than it answers.
Councillor, what page is that? Sorry, before Alison comes to the response. What page was that? The comparison that you were
24.
Page
24.
24. Okay, thank you. Yes, Alison, please.
Thank you, Chair. Thank you, Councillor Harrand. We do have indicators for all of the questions within the survey, and as I said earlier, some of them, because we only have 5 or 6 fire and rescue services who are partaking in this particular survey, so it's difficult to benchmark, and the scores are very high. So, for example, with satisfaction with the initial contact, the national score, the highest score was 98, and we scored 97. But because we were, like I say, the numbers are very small, but because we are less than the higher score of 98, it's showing that we are not in the top ranking. But it's not a significant difference because there's very few fire and rescue services who we are benchmarking ourselves against here.
Yeah, thank you. That's what you told us before. I don't want detail from this. Can somebody send us an expansion of this table so we know where we're 4th, where we're 5th, and where we're 6th? And I say, if you want to treat it as confidential, I can understand that. That's not a problem. That's
fine. I can provide that to you, Councillor Harrand.
Thank you.
Thank you.
Thank you. Is that okay, Councillor Harrand? If that's okay, I'll move.
Yes.
Yeah.
Thank you. And I'll go listen to Judith Blake. Excuse me.
Okay. If that's all right, then we move on to Councillor Renshaw, who's been waiting patiently for the past few minutes. Councillor Renshaw, please, you had a question.
Oops. Thank you, Chair. I'd just like to ask, well, I'd like to first of all congratulate you on all your safe and well visits that you've been carrying out and the impact that it's had on the community. However, with the news recently, or only yesterday, of the impact of the COVID and the fact that we're moving into Tier 3, I wondered if there were any preparations in place for the fire authority and their safe and well checks, because as we all know, it's impacting with a greater effect on those with mental illnesses, or it's creating mental problems, mental health issues for people within the community. And I wondered how the Fire Authority were going to monitor that throughout the whole of West Yorkshire, because it's quite a challenging task. But I would like to thank you for the safe and well visits that you've carried out, because I think it is impacting and it's done a marvellous job for those who are in need. Thank you.
Thank you, Councillor Renshaw. That's a good point. Obviously, you know, it's an ever-changing dynamics that we have. So yes, Alison, would you respond to that in terms of?
Again, could I ask the operational officers to respond to that one, please?
Is that Scott, yourself?
Yeah, I'll take that one, Chair.
Please.
Since COVID started in March, we never dropped off our highest risk prevention visits. So we have still been conducting safe and well visits for those deemed extremely vulnerable. We feel that as we progress through this pandemic, we do understand it better, and we have got very, very good control measures in place now. So what we have been doing since, starting this month, is we are trialling our prevention advisors getting back out into the community with very, very robust checks before, during and after every visit. Once we've done the trials through this month, all our prevention advisors will be going out and conducting visits for high and very high risk people, because we feel we have the greatest amount of control measures in place which mitigate the risk. Once we've got a good evidence base to build these on, it is the intention that from early next year that we will ask our operational fire crews to go out and undertake visits at our medium risk people in the community. Just on top of that, we do understand that COVID is having a significant impact on people's mental health. And one of the Safe Talk spotlights on that I'll be presenting later on in this section does talk about the mental health training we'll be delivering to our operational staff, which is about having the ability to identify mental health issues in both colleagues, members of the community and family members, being able to talk about it, and also signposting what support is available. So we think we're approaching it from a couple of angles on this one to make sure we can do the best that we may can.
Thank you. Is that okay, Councillor Renshaw?
Yeah, thank you for that. I'm glad you've turned.
Sorry, I didn't hear the bit that was lost, Councillor Renshaw.
Sorry, I'd just like to say a thank you, because I do think people sometimes forget that services like the Fire Authority do have staff who probably are under pressure and may be prone to concerns of like the impacts of COVID. So I do welcome the fact that you're taking the thoughts of staff into account as well. So thank you for that.
Thank you, Councillor Renshaw. Next is Councillor Mike Pollard, please. He's been waiting, I guess, quite patiently as well. Councillor Pollard.
Thank you, Chair. Not a problem. Turning to the safe and well visit follow-up survey. On looking at this in more detail last night, I got a little bit confused, I have to say. Looking at section 3, the initial contact data. We had overall 458 respondents, but the little chart at the top of section 3 on page 30, the 2019-20 data doesn't add up to 100%. So I was a little bit confused about some of the numbers there. We seem to have sort of lost 53 respondents from that table somewhere. So that was slightly puzzling. Secondly, if we look over on page 31, this was rather interesting in that I do sometimes wonder how these safe and well visits are triggered. And obviously, it's frequently as a result of referrals from other agencies in respect of significant worries that those agencies might have. And looking at the large table on page 31, no fewer than 57% of residents stated that they were given fire safety advice on housekeeping and hoarding and lifestyle behaviours such as drinking or drug taking. And that's a really significantly high percentage of visits where the fire safety officer regarded that as a significant piece of advice to give. In other words, you would assume that there was something that would have raised that concern in the first place. And yet the overall response rate and satisfaction rate remains extremely good, even though presumably some of those household settings were somewhat dysfunctional. But if you could just discuss that one slightly.
Okay, thank you, Councillor Pollard. Thank you, Chair. Just to respond, if I can respond to the first question, which is regarding the numbers missing on the initial contact. Not everybody completes all the sections within the questionnaire, and we can't control that. You know, they will either miss that particular question or not want to answer that particular question. So within the report, the figures don't always add up to those totals of 100% because they may well have not answered that particular question, and that's entirely for whatever reasons there are. So sometimes those figures don't add up there. Regarding your second question regarding the housekeeping and hoarding, perhaps Scott, would you like to go into that?
Yes, I'll take that one, Alison, thank you. The Safe and Well visit is quite well established now, Councillor, and all these elements will have been discussed with all the people we go and speak to. Our firefighters and our prevention advisors are now very, very skilled at applying diplomacy with some of this stuff. As you can imagine, and what we also allow them to do is apply a level of discretion as well. So when it becomes very, very obvious that housekeeping isn't an issue, we may give some slight guidance, but we also will not go through our full range of guidance, and that'll depend on what the advisors see at the time. And that's very much the same with the drinking and drug taking. We are very, very diplomatic in our approach about the advice we give, and I'm absolutely certain that where necessary advice was given, but the way that it was given might not have been as overt as some people received it. So by applying that discretion, giving more advice where it's actually required and holding back on some, I think that's where we're getting this variance. And I think, as it says, we'll probably see a lot more smokers. We will very much touch cooking safely very, very frequently, and candles are a big message we give. Because we're less likely to see evidence of excessive drinking or drug taking, which is likely to lead to a fire, we may not always give that advice, or we may be a little bit more restrained about how we do give it. So I think that's explains some of that variance.
Okay, thank you. Is that okay, sir?
Yeah, just going back to the initial query on the table not adding up to 100%. It did add up to 100% the previous year, so there's a chunk of data there that seems to have got lost in the mix somewhere. In fact, 2018-19, to be strictly accurate, rounded to 101% responses. But yeah, there's still a question there as to the appropriate percentage of reasons for the Safe and Well visit being made in the first place.
Thank you, Councillor Pollard. I will just double check that, and I'll come back to you with that on that if that's okay.
Yeah, thank you.
Thank you.
Thank you, Councillor Pollard. Thank you, Alison. Yeah, I've got Councillor Angela Wenham. Would like to ask a question. Councillor Wenham, please. And could you also turn your camera on when you're asking a question, please, Councillor Wenham?
I am. Yes, on page 31, and again about the paragraph with the actual fire safety advice. And when it says cooking safety, can you break that down for me a bit? I.e. like cooking with oil and various stuff like that.
Thank you, Councillor Wenham. I'm not sure within the questionnaire whether it breaks it down to that extent. So I may not be able to break it down any further, but I will certainly look at that. And if we are able to do so, then I will come back to you and give you a clear breakdown on that.
And also, how do you give any advice how to dispose of of hot oil.
Can I pass that over to you, Scott, please?
Yeah, absolutely, Councillor. It's coincidental that later on in this presentation we will be talking about hot oil fires. Hot oil does play a major part in our cooking advice. Things around frequency of cleaning of oil, how far you fill your pan, things around what not cooking under the influence of drugs or alcohol, not overfilling your pans. So we do give lots and lots of advice on the use of hot oils, and I will discuss that further on if that's okay.
Is that okay,
Right,
Councillor?
thank you.
Thank you. Are we all okay with that? Anybody else that I might have missed?
Me,
I can
Gola.
Gola. Hear him.
Councillor Graham.
Councillor Graham, please. Yeah.
Raise the following on the school safe and well visits. It's on page 11 of mine and on the page 35. When the officers attend the school, do they look at the fire register for the amount of incidents that actually are recorded in there in the school for evacuation purposes, or for whatever reason there's a possible fire or alarm goes off? Do they actually check the registers? There's nothing here that indicates they check the registers when they go into the schools, Chair.
Sorry, Councillor Graham, which register are you referring to? Is that the register where they registered incidents at school? Councillor Graham?
The registers that are available when you go into the school, it should be in a prominent position for a fire safety evacuation and recording of incidents, Chair. Do they actually check this book at all?
Thank you. Yes,
Thank you. Thank you, Councillor Graham. Shall I just say, this particular questionnaire is asking questions regarding the school fire safety talk to the pupils. This isn't regarding an inspection of the school premises in any way. It's more about giving school talk and advice and guidance to the pupils. Scott might be able to help you with whether they will check the register when they're going in to actually inspect the premises.
Councillor Graham, are you referring to the safe and well visit or?
Safe and well visit, Chair, yes.
Yeah, okay. Yeah, I think Councillor Graham is referring to the safe and well visit.
Hello, Chair. I'll take this one.
Okay.
When we do go to these schools, our primary focus is an educational visit. Although we will cover evacuation from the school should a fire alarm take place. We don't automatically check any other aspects of the fire protection available in schools during these visits. However, we do regularly undertake visits at schools to check that kind of element of the safety there. So when we do our ORVs, our operational risk visits at schools, we will check a whole host of factors like that. For these visits, they're very much prevention based, about giving advice.
Thanks, Scott. Okay, I've got the message. Thank you.
Thank you. Are we all okay with item 6? If we are, because I don't see any hands up there. Okay, if that's the case, thank you very much, Alison, for a wonderful report and explaining it to us as well. Thank you very much indeed.
Thank you.
And we will move on now to item 7, which is the district priorities, and it's a 6-monthly report and update, and that starts from page 41. Scott, yourself, please, over to you.
Yes, thank you, Chair. So this paper is provided to members to give an update against the 6 monthly priorities that were approved in April this year. Obviously, the district priorities have changed. When these were approved by members, we weren't fully aware of the impact of COVID. However, a lot of the priorities do still give a lot of value and are something we can perform against. Each of the districts have adapted very, very well to the challenges provided by the COVID pandemic, whilst continuing to provide prevention and protection advice to those that need it. Some of the elements I will draw your attention to through this paper is to get into Appendix 1, the actual district breakdowns. It was raised earlier, but in all the district priorities for each of the 5 districts, we do talk about delivering safe community strategies and prioritising prevention work. We have continued to do that, and those most at need have received a service from our specialists. We have continued to provide fire retardant materials, smoke alarms, and other interventions for those most in need in our communities. Additionally to that, we have amended our station assurance visits. These are visits that are undertaken by the district command teams to make sure that stations are performing to the required standard, training is well embedded, and station-based service delivery staff are given the best service possible. These have been adapted now to ensure that all our staff are maintaining safety through the COVID pandemic by adhering to COVID measures, such as social distancing and the hands face-to-face messages. We have also been very heavily involved in the community through volunteering work. So through the tripartite agreement, work through in conjunction with the NFCC and our representative bodies. Over the last 6 months, we have been working through delivering food parcels, pharmacy supplies, delivery of PPE, supporting other agencies, and as much as possible supporting the health service in combating the pandemic. Additionally, and again, that's something I'll speak about further on down the line in the spotlight on, is we have been supporting Leeds with the Falls pickup service to try and take some of the strain off the ambulance service and helping out what we can do there, but I'll explain further as we get into that. So as we look at the district priorities across each of the 5 districts, I think what we can see this time round is although we have seen lots and lots of challenges, as a service we've responded very well to them and we continue to deliver an excellent service. I'm open to questions after that, Chair.
Thank you, Scott. I don't see any hands up. Any questions or comments? Councillor Pollard is the first one. Councillor Pollard, go ahead, please.
Yeah, just on the district priority papers. Obviously, as a Bradford member, I have regular briefings with Ben Bush, the district commander, and we do discuss things such as the availability of fire cover in Wharfdale. So we have discussed that, and it is improving, but it would be good perhaps just to see the percentage availability figures in this report in respect of that. Another query, which is more really, I guess, across the piece in all districts. Pleased, obviously, to see that operational competence training is being maintained and everybody fully up to scratch. But when it's stated that COVID has significantly impacted on district training, which bit of training has had to go by the board, really?
We have maintained all our actually 6 critical competence training. It's more about how we deliver training. So what we do like to do is we'd like to do cross-station training where we'll bring multiple stations together to exercise or really get the most out of the training. To try and restrict the spread of COVID, we're trying where possible not to bring multiple stations on. As you can imagine, it'd be disastrous if one person were at a particular station were to infect 3 around them. So it's not so much training has dropped off. We are still maintaining training and we are maintaining competence. It's just about how we deliver that training, which is being the challenge on that. And regarding the Wharfdale cover, I will provide an update on that, Councillor.
Thank you, Ken. That's good. So presumably, obviously, we're not going to have any sort of major 12 pump exercises to see how things work in a tower block. That's the sort of training that would have to be suspended for the time being, I guess.
I think what we do need to make sure is that our fire crews are as prepared as they can be to respond to these kind of emergencies. Obviously, tower blocks are something we are very, very keen to be able to deliver the best service possible. I think it would be remiss of us if we didn't train firefighters to be able to deal with this kind of incident. So in that situation mentioned there, I think this will be one of the cases where actually we will use it as an opportunity to exercise our COVID control measures, but also realise that there is a need to be able to exercise our response to this kind of building. So we will get the balance right for that one, and that's probably the type of exercise we will see where we're bringing crews together.
Okay, thank you.
Thank you. Councillor David Curtin, please.
Yes, thank you, Chair. Just a question for Scott, if I may, regarding the issues in Calderdale, and I just wondered if you could just provide me with an update of the situation with regards to Mytholmroyd Fire Station, which was badly affected with the floods earlier this year.
Thank you, Councillor. Scott, please.
Yeah, absolutely. I'm pleased to say that the works at Mytholmroyd are almost complete. It's obviously fully operational as a fire station at the moment, and the things that are going now are mostly administrative and storage solutions that we're putting in place. The fire station is well protected. We have done some works around mechanical and engineering to make sure that if the situation were to arise again, our business continuity will be maintained at Mytholmroyd as much as possible. And obviously, if it came to the situation where Mytholmroyd did find itself underwater again, we have got arrangements in place where we can quickly reinstate the fire station. It won't take as long as it has done previously. The crews have worked really, really hard down there to contribute to that. They've gone all out to try and bring that station back to life as quickly as possible.
Thank you, Chair. That's great news. Thank you, Scott. And I would just like to also just add that I'd just like to thank the district teams for all the hard work they've been doing in Calderdale over this year.
Thank you, Councillor Curtin. Thanks for that. And thank you, Scott, for the answer as well. Councillor Jenkins, you'd like to ask a question, please. Councillor Jenkins.
Yes, please. It's partly a comment, but my understanding is that it's really up to the coming up to bonfire night and looking at what sort of incidents that have been taking place. And I understand that across Leeds, for instance, and probably across West Yorkshire as a whole, partly related to COVID and people's reaction to it, that there have been numerous incidents of antisocial behaviour, which sometimes have involved use of accelerants to set on fire cars and so on. So I just wondered what the situation is and what preventative measures can be taken. In Leeds, there's a court order that affects mainly people over 18, trying to restrict the use of fireworks and so on. So which could perhaps be extended across the whole of West Yorkshire and may happen next year. So I just really wondered if there's any comments that could be made, anything that we can do to alleviate the situation and be preventative. Thank you.
Yeah.
Thank you, Councillor. As I'm sure you're all fully aware, bonfire night does tend to be our busiest period in its very nature. And we have seen instances of antisocial behaviour. What we have been doing since August this year is working with the police, working with the local authorities and other partners to come with a combined response to be able to challenge some of this behaviour. Over the period, we will have additional resources available to us. These will keep resilience in our fire engines, they'll maintain an appropriate response, but they will also keep the safety of our fire crews. On top of that, we have been giving out fire safety advice. We've done a couple of social media sessions this week alone. We do have one of our officers going on to national television next week, and we've also done a number of radio interviews to try and give advice about not having bonfires, not having fireworks, particularly in a domestic setting. And then if people absolutely must, the safe advice they should follow. On top of that, we are giving reminders to all our crews about the safe approach to areas where they think there may be issues. We do have an internal system where we do record where antisocial behaviour has happened. So all our crews, if they are turned out to them areas, are fully aware of the potential implications. So we cover it from a prevention element to begin with, where we try to mitigate the risk. We look for opportunities to remove refuse or damaged cars which may be set on fire. We work with the communities through community engagement to try and reduce the risk. And then when it comes to response and resilience, we make sure we've got additional resources available to us so we can always maintain our normal business as usual response.
Yeah, thank you.
Thank you for that, Councillor Jenkins. We've had a similar sort of approach in South Leeds. Just to give you an example, we, that's collaborative approach with the police, with Leeds City Council's cleansing team, with the LASBAT, Leeds Antisocial Behaviour team, other council elected members, and various third sector organisations, as well as the West Yorkshire Fire Services. In South Leeds, in particular, we've been having meetings since August of this year, and we've done a lot of outreach work and sort of awareness programs and whatever on radio and TV and so on, which Scott was just discussing, and that's really helped. I'm sure it would be useful if we can get some sort of update on district level, so that would be good as well for all of us as to what work has gone into it, because it'll be good sort of indicator and a good practice sharing for next year as well, because this year has been a different year. And also, for example, a couple of things in Leeds, you must be aware of that already, Councillor Jenkins. This year we've had the Leeds Light Nights, sort of show, with laser lights and stuff like that. So hopefully on bonfire night, people would be more sort of rather than getting into the fires and all that and getting together, would be doing something different this year. So that's what we hope for. But yeah, that's a very good point that you raised with regards to raising awareness and engaging. Is that okay, Councillor Jenkins?
Yeah, that's fine. And just to note, Tier 3 coming in on Monday morning will probably have some effect and perhaps encourage people to stay at home even more.
Absolutely. Couldn't agree more, Councillor Jenkins. You're right. Yes, Councillor Renshaw is next, please. Councillor Renshaw, please.
Thank you, Chair. I'd just like to sort of echo the words that you've said about the collaborative working that's been taking place in Leeds. I know they're working well with Housing Leeds, and they've been looking at ensuring all the high-risk buildings are becoming safe. So can I thank the Fire Authority for doing that work, and also other agencies that are involved as well.
Yeah, thank you. That's a good comment. Is that okay? Yeah, I noted that. So thank you for that, Councillor Renshaw. If that's okay, I think I've seen Councillor Pollard's hand again. No, sorry, it's been lowered. Okay, so if that's the case, if you're all happy with it, then we might as well move to.
Chair, just before we move on, can I just ask? Like we welcome the collaborative work in Leeds, but I'm just wondering if it goes on throughout the whole of West Yorkshire.
Yes.
Do all the other authorities do the same?
Yeah, in terms of consistency across the districts. Good point.
Yeah.
Is that the case, Scott?
Absolutely, Chair. Obviously, the risks are very different across the districts, but we do have very, very strong relationships with all our local authorities and third sector organisations who do support us with this, the local neighbourhood centres, schools, the authorities and police. So yeah, to different degrees and to manage different risks, it does happen right across the county.
Thank you, Scott. Thank you, Councillor Renshaw. Moving on to agenda item 8 then, which is the annual report and update on the youth interventions team, again by Scott, please, and space.
Before we move on, Chair, could you just ask the administration to put my initials up on the screen? Because when I've wrote down the actual question I put here, it's not been in. I can bring it back to item 13, Chair, so that you know I'm putting a message on the screen. Can you ask them to put RG up on the screen so you know I'm putting a message onto you?
Sorry, where are you putting the message, Councillor Graham?
When you in the chat box, I put the message in there, but then there's no RG on the screen to say I'm indicating a message. Are you with me, Chair, with the hand up and that?
Right. Okay. Sorry, I didn't see your hand up.
Yeah, it's not on the screen, RG, you see, as if they aren't there, you see, again.
Right. Okay, I can see you, but if you have a question, Councillor Graham, could you just raise your hand on camera like that? So at least
I can do. I'll leave it with item 13 now, Chair. I'll leave it well item 13 now. I can bring up under that heading, Chair.
Okay, thank you. Thank you. Thank you, Councillor Graham. So moving on to item 8 again, which was the youth intervention team's annual update. Scott, please, from page 67.
Yeah, thank you, Chair. So this report presents the progress of the youth interventions team for the academic year 2019-20. It is important to note that unlike a lot of the other reports we'll be presenting to this authority, that the youth interventions team do run the academic year, so it's more closely aligned to school-aged children and young people. It's obviously been hit very hard with the youth intervention team because of COVID. With children being stopped from March onwards, we've lost 6 months of potential intervention with some people. That said, this report does highlight how the youth intervention teams have worked in it in a very innovative way and also adapted very well to social media and digital to be able to deliver their services in a way that no other services across the county or even across the country have been able to do. The youth interventions team do rely heavily on partners and working with them, such as youth offending teams, probation services, schools, and this is where we get the vast majority of our interventions. What we do like to do is work very, very closely with young people. We find that the personal touch does have the best outcomes, but unfortunately we haven't been able to do that. So what the team have developed are digital ways of working. We are one of only 2 fire rescue services in the country that's delivered a digital Prince's Trust. This has been seen and fed back from the Prince's Trust as an area of an outstanding practice. The team are very, very dedicated, so they still have been maintaining contact with those most high-risk individuals. And the youth interventions team do work with young people that are deemed either at greatest need of a blue light response or ones that are likely to invoke one in the future. So it's very much about, one, protecting their futures, but also reducing the impact on other emergency services. Throughout the year, it has been a shame that we haven't been able to deliver as many programmes as we'd like. However, the team have worked hard. They have been taking work off other teams in the service to spread the workload effectively. So the youth intervention team have been picking up a lot of work with our fire setters. And this can probably be one of the reasons why we see secondary fires have been so successful this year round. And the next step now is developing and maintaining the contact with our young people, with the agencies where we do find the greatest number of our referrals, and also developing our training materials. So when we do come back to deliver full programmes, we can do it very, very successfully. We have been back in schools since September delivering programmes, and we currently have a Prince's Trust team running at the moment from Dewsbury Fire Station. So on the whole, the middle of the year, it has taken a little bit of a hit, but we have continued working. The team have worked very hard to deliver a lot of programmes for a lot of people, and we are gearing back up now to be as successful as we can. Have to take any questions.
Thank you, Scott. I've got Councillor Pollard, please.
Thank you. Thanks for that. Section 2, para 7 and 8, basically on page 69 of the document. Identified of the 75 fire setter referrals received in the last academic year, 42 were deemed high risk. In the following para, we see that we've successfully worked with 34 of those 42. Were the remaining 8 just not able to be easily contacted, or what were the circumstances there? And
sorry, Councillor.
And as a follow-up to that, really, have there been sort of any increase in fire-related incidents that could have been situations where those youngsters had fallen slightly and understandably between the cracks?
I think obviously the fire safety programme is something that, as a fire rescue service, we do reach out to individuals, and in the vast majority of the cases, the families do respond well to that. There are some situations where either the individual or the family or other issues prevent us from getting it to the true nature of the intervention as much as we'd like to. So we will reach out to each of the person identified as a fire sector, but we do need a little bit of support from families, which isn't always the case, unfortunately. That said, we will always give as much advice and guidance, whatever level we can do that at. In terms of individuals who may have gone on to set fires, we do work. This is not a one-off hit. This is not just a case of we'll drop in, give advice and come away. We do build established relationships with these individuals. There may be occasions where some of these people have gone on to set additional fires, and it may just be a case that we haven't picked up on them or we haven't been able to link them. I can't see either way on that, councillor.
Mm. Yeah, just as a follow-up to that then, where we don't have any success in making contact with the families of the youngsters that are involved in as high-risk fire setters, do we then feed back that lack of success in making contact to other agencies, for example, the police?
What we do, so although some of the families may not be completely receptive to the advice we're giving, we do put interventions in the house straight away. So one of the things we will always do is put additional fire protection and fire alarm systems in place. So if this is something in the house, that we try to maintain the health and safety of the individuals in that particular house. Where we identify that the fire sectors, haven't responded as well as we can, we will attempt a multi-agency approach where it's deemed necessary. This will depend on the degree and severity of that individual, and also the likelihood for them to set them fires. So where it's deemed necessary, yes, we will contact other agencies to refer through.
Okay, thank you.
Thank you, Scott. Is that okay, Councillor Pollard? Yeah.
Indeed, yeah. Thank you.
Thank you. Just a quick one. In terms of the percentage, from youth offenders and probation services, what sort of referrals are we getting? In terms of percentage we're taking part in this. Do we have any figures on that at all?
I don't, I'm afraid, councillor. But I will get that for you. I'll speak to our youth intervention team and look at the kind of referral rates from different partners.
Brilliant. Thank you. Thanks for that. So if we don't have any further questions on item 8, which was youth intervention team's annual update, Councillor Graham, are you happy with that as well? Yeah, because I can't see you on my screen, unfortunately. That's the case, and you can't sort of come onto the chat as well for some reason. If everybody's okay with that, we'll move on to item 9, which is the service delivery spotlight on the case studies, page 77, and it talks about Safe Talk, falls pickup, and also youth intervention and Princess Trust team delivery. So again, delivered by Scott, please.
Thank you, Chair. So this is the spotlight on which identifies areas of excellent practice for councillors. There are 3 spotlights presented to this meeting. The first one being Safe Talk, the second one the Leeds Falls Pickup Programme, and the third is the Youth Interventions Training Digital Programme, which I've lightly covered. So the first one is the Safe Talk programme. As was mentioned by Councillor Renshaw earlier, mental health is something which we are getting better at talking about, and it's something we are seeing more prevalent in our communities at the moment. What we are doing is to respond to some of this is equipping our operational staff with the ability to recognise this, have the confidence to speak about it, and also signpost where we should be going further if needed. This is a presentation and a discussion delivered by our prevention team. We will be rolling it out to all operational staff over the next couple of years. As you can imagine, it is going to take a long time to get around all our stations and service delivery staff. But the feedback we're getting is very, very positive about giving confidence to start up conversations. It takes away some of the taboo around potential suicide. And it also makes it very clear that removing some of the stigma around mental health. This is not only in our community, this is within our workforce as well. So it's about looking after the person next to you. You know, we do have quite a difficult role, and it gets to the best of everybody. So this is about equipping our staff to be able to deal with some of these more difficult conversations. Is there any questions on the Safe Talk?
Thank you, Scott. Thanks for that.
The next one I'd like to speak about is the Leeds Falls Pickup Programme. So it was highlighted quite early on into the COVID pandemic that the health and in particular the Yorkshire Ambulance Service highlighted there will be a really large demand on their service. So we were contacted by YAS and asked if we could support them with some of their users in Leeds who have mobility issues, who may not be able to get themselves up after taking a fall in the home. Just to make it clear, these are people who, although have mobility issues, are not requiring critical care. So the situation we've got in place now is that if somebody rings YAS and tells them that they're falling in the home, YAS will do a triage system to ensure that there are no significant health issues or private health issues requiring emergency response. Previously, that might mean that the person would have to wait a very long time. You know, we're talking maybe 6 to 8 hours for a response to help them up. By referring that to us now, we can get volunteers out to them within 1 or 2 hours to make sure that person is more comfortable as quickly as possible. So that has been working since March, and we've recently extended that trial to go through to March next year, obviously with the re-emergence of COVID. There are some figures in there. We have done 13 patients that have been lifted off the floor. We have asked YAS to attend a number of patients, and at the moment it's proving very, very productive. The crews that are going out and doing it, these tend to be our volunteer, our service support staff. The feedback from them is they're finding it very rewarding to be able to go out and deliver to their communities. And YAS are also feeling back that it is also taking the demand off them, because these incidents do take 2 to 3 hours at a time to resolve sometimes, which is a long time for life-saving results to be available. So that's an excellent example of collaboration there. And then the third spotlight on is the youth interventions and the Prince's Trust delivery. So as I mentioned, the best way that we can deliver Prince's Trust is face-to-face, by having that personal interaction with the young people. We haven't been able to do that as effectively as we'd like through COVID. So the team worked very quickly and very hard to deliver an effective programme, which was more based around social media, mobile phones and messaging, to deliver a programme which enabled them to develop confidence, social skills, build relationships with our interventions trainers and also other members of the group. And at a time when a lot of young people are feeling isolated, this was a good way to build some avenues in that area. So it's another example about how we've adapted to the challenge COVID has given us. I'm happy to take questions, Chair.
Great. Any questions at all with regards to Safe Talk? All working collaboratively with the Yorkshire Ambulance Service, Falls Pickup, or Youth Interventions, Prince's Trust delivery? Any questions on that? I've got Councillor Pollard again. Sorry, Councillor Pollard. There you go. Please.
Okay, thank you. Yeah, it's just a query on the falls response stuff. Obviously, a really good Leeds initiative. Firstly, can I ask if that initiative is to be spread around the other districts in the service? And secondly, just wondering how in practice this works. If it's an elderly person who has fallen and phoned the ambulance service, and it's referred through to us, you'd like to hope that in many instances, the front door of the residence was safely secured. If it's a fall without further obvious complication, although I see that from the figures, in 3 cases there was actually further referral to the ambulance service because the crews were in some doubt about the initial medical triage. But if you don't get a response, is the matter then escalated to the potential for a little bit of gentle persuasion on the front door by means of the forced entry protocol? Just wondering how in real life some of these situations pan out. It sounds as if it's all very straightforward, but I'm sure in practice sometimes it isn't.
Absolutely, Councillor. I'll take your first question first, if that makes sense. The way that this is commissioned out across the 5 districts is different. So the clinical commissioning groups award a contract to different agencies across the 5 districts. In Leeds, that just happens to be YAS. It's not the case across the other areas. It would make it a little bit easier if we were to look at expanding this trial if that was the case. However, in other areas, it is picked up by different private companies. So that's why at the moment we are only doing it in Leeds.
Okay.
In terms of what happens when we get there, as you say, we will ideally the front door is open or available to us, or we can get a key safe for those that are vulnerable, and we can get that information provided to us. If that's not the case, we will try and make contact with the individual in some other way. If that means we can get a telephone number for a family member to support us to get in, we'll use that way. If after all that, and that person is still on the floor in a very uncomfortable position, we will, as you mentioned, use some gentle persuasion. Now we have a number of ways of doing that where we can limit damage by using specialist lock pulling equipment. If need be, we'll get an operational crew out, and if windows are open, we'll try to be as intrusive as possible, or try to minimise how intrusive we are. But if it comes to it, and based on what we see at the time, we do need to be a little bit more forceful, we will do that. At which point we'll invoke our memorandum of understanding with the YAS to force entry.
Okay, thank you.
Thank you. Thank you, Scott. Councillor Renshaw, please.
Oops. Thank you, Chair. I'd just like to ask about the delivery of the Prince's Trust scheme, not an employment, education or training. So I just wondered if you worked with the youth service to deliver that, and I know it mentions Dewsbury. Is that going to be delivered throughout the different areas of West Yorkshire? And do any of those young people go on to then apply to work for the fire authority?
Some great questions there, Councillor. Thank you.
Thank you.
It's delivered at Dewsbury because that does seem that we do have the best resources there. However, we do have young people from across the county come to Dewsbury. We are working very, very closely with colleges, third sector organisations, and even colleges outside of the county who are looking at commissioning us to deliver Prince's Trust. So we don't have a very small base, we have a very wide base that we do draw upon. And we do offer our services right across the board to lots and lots of different agencies. So yeah, we don't restrict who can attend these groups. It is a very, very open and inclusive advert, really.
Good, thank you.
Can I just ask then, is transport provided for those who are not in education and who come from disadvantaged backgrounds? Because obviously to get to Dewsbury from the other side of Leeds, you know, from North Leeds, it'll be very difficult for some children, and they won't have the transport provision.
Yes, we do offer reimbursement through the Prince's Trust. We offer reimbursement for bus tickets, and we do provide public transport funding. So we do that, make that available to people. We also offer food and meals.
Wow. Thank you for that.
That's really good. That was really good point. But is there a chance to work in a way collaboratively with the combined authority, with the for example, with some of the bus companies in terms of providing these people with some passes, sort of as a partnership? Could that, because that would be good for their PR as well, wouldn't it? And also, and also it's not a big deal for them, to be honest. So can we do something with that regards? Because Councillor Renshaw is absolutely spot on. He'll encourage more people, but if it's not sort of a big burden on the financial in terms of that on the fire authority, it would encourage more and more people as well.
Absolutely, Chair. I'll pick that one up.
Thank you for that. Councillor Jenkins, you'd like to ask something?
Yeah, it's just really on the falls issue. We've managed to get some funding through the Neighbourhood Network Scheme in Leeds to provide key safes in some of the high-rise blocks where there's been a lot of isolation in many ways because of COVID. And so I just wondered, how do you publicise the key safe scheme, who funds it, and whether people can be put in touch with agencies like the Neighbourhood Networks projects in Leeds, which probably exist in other parts of the authority as well?
Thank you for that, Councillor. We don't really do a lot of advertising for key safes. When I mention key safes, we tend to get referred to the address, and the key safe is provided to us in terms of the combination. It's not something we currently provide or provide guidance on during our safe and well visits. But if it's something you'd like to speak about later, or there's some options we can take up there, I'd be happy to follow that through with you.
Okay, yeah, I'll send you some information and give you some contacts.
Thank you.
That's brilliant. Thank you, Councillor Jenkins. If we're all okay with that, that was a good presentation, Scott. I think then we'll move on to item 10, which is the occurrence of hot oil fires, and that's from page 89. Again, over to you, Scott. You're a popular man.
Yes.
Scott.
You'll be getting bored soon enough.
It's got it in for you today, Scott.
At least you've been generous with your questions, councillors. Right, so yes, this is a short paper just for note on the occurrence of hot oil fires. I think this was a request of one of the councillors. I think we did originally get asked to look at chip pan fires, and we've just changed it because what we are seeing is chip pan fires do tend to be less frequent than we did before, but we do see an occurrence of other fires associated with cooking, such as karrais and woks and the like. It is a small number of fires, but also obviously a significant number of fires. The fires do tend to be concentrated in our high-risk areas. Unfortunately, through our risk modelling, this does tend to be where we provide most of our risk intervention. As mentioned by Alison Davey before, cooking is a major part of the advice we give during our safe and well visits, and part of that is hot oil fires. And in fact, some of the guidance that we do provide is in the front page of this paper regarding never leaving cooking unattended, never use drink or alcohol when you're cooking, think about your clothing that you're wearing when cooking, the changing over of oil, and also the cleanliness of the area you're cooking in. So we do provide a lot of advice when we are dealing our safe and well visits. It is something we also push on our social media. There is a picture there of one that taken off our Facebook in the last month, which shows about the dangers of hot oil. And the hot oil fire display unit is something that at every opportunity at our open days we will get out, because it does very clearly demonstrate the difficulties provided by hot oil fires. Through the research, we've found that there are a number of wards which are, we see a lot more of these fires than others. They tend to be in our very diverse communities, particularly around Hunslet, Middleton, Armley, Beeston, Bermontoft and Manningham in Bradford. And what is really reassuring with some of this stuff, although we do have these fires and they are slightly on the rise, very few of them do the spray, very few times are the spray from room of origin, which would indicate that the advice we are giving about not trying to fight the fire, closing the door to the kitchen very, very quickly, getting out and calling the fire service is being listened to. Again, obviously high-rise buildings are very much at the forefront of everybody's thinking. We don't see a lot of hot oil fires in our high-rise buildings. I think some of this is down to the fact that a lot of high-rise buildings don't have a gas supply, so people tend to be cooking on electric, and we see a lot less ignition through that way. As a conclusion to this paper, yes, we are seeing a slight rise in the number of fires. We will concentrate on this when we get out, and we'll make sure it's a priority when we deliver our safe and well visits. And it'll be something we continue to monitor. I'm happy to take any questions.
Thank you, Scott. Just a quick one, since we, thank you, Ron, I've got your indication, but just a quick one before Ron comes and asks the question. In terms of hot oil related fires, when we do the safe and well visits, do we offer people some sort of advice on hot oil related burns and injuries as well? Because obviously, you know, people who contact us primarily contact us for the fire and not for the hot oil related harm or injury they can have, you know, or burn. Because like you rightly said, you know, high-rise buildings, because they're electric only and don't have gas supply, perhaps, you know, don't have many fires such, because it doesn't ignite to that temperature, you know, in the absence of the flames. But in terms of the injuries, I'm sure the figures must be kind of consistent, you know, with other, you know, living in other kind of residential settings as well. So during our safe and well visits, can we make sure we add something toward the oil-related burns and injuries as well, like we did with the cream, lotions and creams? It would be nice to have something along those lines as well.
I think that's something we could do through our social media, Chair. That would be the best approach to that. Yes, it's something I'll work on.
Yeah, lovely. Thank you. That's great. Councillor Ron Graham, you raised your hand.
Thank you, Chair. Can you hear me? Yes. Yeah. The thing that I brought up before, where all fires are concerned, is that where the spray is concerned from a bottle tap, the plastic bottle, we need the research and development to take a grip of this situation, where the amount of oil they actually spray into the frying pan or whatever they want to use it for. The thing there now, we've got these chemical sprays that come on the scene. This is what causes me some concern, that where the amount of pressure you put on that comes out too much and then the fire occurs. But what I would ask for permission to do is that where the paper you presented, Scott, I'd like to photocopy that and get it out into the ward for the benefit of the people to actually see for themselves what great work you're doing as a team and that, like, you know what I mean? So I'd like permission to photocopy that and get it out into the ward. I pay for the paper that I use down at Leeds Civic Hall, so I don't want to put any pressure on the council's budget regarding what they actually supply as paper. I pay for my own paper to print and that.
I think, Councillor Graham, it is in public domain anyway, so I don't see any issues with printing that, and perhaps that would be very nice of you. I think is that right, Scott?
Absolutely, Chair. And just for awareness, in the local papers, I know that the Telegraph and Argus and the Yorkshire Post, even in addition, have both picked up this report, and it has been published along with the advice, which is very helpful.
But also in terms of being more helpful to the public, because obviously, you know, there's lots of pages there with other information as well. Would you be possible to send us a one-page kind of condensed summary of that could be photocopied and or published and shared on social media? I think that would be more useful, you know, condensed form onto one page or maybe maximum 2 pages.
That's a good idea. That's a good idea, Chair. Yeah.
Yeah, I'll get that out to you, Chair.
That would be excellent. Thank you very much indeed. Councillor David Curtin, please.
Yes, thank you, Chair. Scott, you mentioned that chip pan fires are actually on the way down, which is good news. But since I joined the West Yorkshire Fire Authority just at the beginning of this year, I was still quite surprised how many chip pan fires we have. Just correct me if I'm wrong. Did at one time we used to provide electric fires free of charge to people where they'd had a fire as a result of a chip pan? Am I correct in saying that?
What we did used to provide is deep fat fryers, Councillor.
That's what I'm thinking of. Yes.
But what we found with them is they weren't always looked after as well as they could, and also our message is, where possible, don't cook with oil at all. Effectively, that's still a hot oil device, so although it's slightly safer than an open pan, we're still encouraging people to, where possible, not use any oil whatsoever. So to conform with our messages around that, we don't offer our deep fat fryers anymore.
Okay, thank you for that, Chair. Thanks, Scott.
Thank you, Councillor Curtin, for raising that. I don't know how we're going to sort of promote that, but I mean, we use the air fryers. They're really far more healthier option, and to be honest, you know, they do the job as well. You know, they fry them really nice. So it's benefit in two ways, to be honest. You know, prevents the fire issues without the oil, and also health-wise, I mean, I find them perfectly
Yeah.
good.
I fully agree with you there, Chair. The only thing is they are quite expensive for people to buy, I believe, aren't they?
Relatively, perhaps, yeah, but it's a good option, yeah.
It's a good point, yes, yeah, I agree.
Thank you, Councillor Curtin. Councillor Jenkins, you wanted to ask something.
Yes, thank you. It was me that requested the report in the first place, so I thank the officers for presenting it. I just wondered whether, having been picked up by two of the newspapers locally, whether it'd be worth doing an actual press release to cover the whole of West Yorkshire on this issue. It might be helpful, particularly to get it to some of the housing authorities as well.
I'll speak to our corporate communications department about that, Councillor.
Yeah, thank you, Councillor Jenkins, and thank you for actually putting the information as well. Thank you for that. Councillor Wenham, would you like to ask a question, please? Councillor Wenham?
Yes. Yes, yes. It's a very good report on the
Councillor Wenham, are you there? We can't hear you for some reason.
Sorry. It's a very good report. What I'm wondering, looking through the report, how do you get this to the non-speaking diverse community?
You mean non-English speaking people?
Yes, this information out to the non-speaking English community about the hot oil information.
Yeah, thank you. Obviously, this report is for the Fire Authority, and like I say, I will provide a summary which can be released more widely. When we're going out and giving our visits, our crews do have a number of avenues they can pursue when we do come across people who where we do have a language barrier. We do have methods that we can provide all our advice where it's needed. So if when we're giving our safe and well visits and we do need to give advice on cooking, or we find somebody who's particularly at risk from that, we do have a number of avenues we can provide or follow through with to be able to get the messages across.
Thank you.
Right. Thank you.
Thank you for that. And may I also, Scott, I'd be happy to put you in touch with at least a couple of non-English speaking TV channels. I know some people, so I'd be happy to kind of refer them over to you if you wish to have a quick chat with them, and they will make a report in Urdu and in Punjabi, so at least two of the languages, and they're widely watched by thousands, hundreds of thousands of people across on satellite TV. So if you wish to, I can put them in touch with you, specifically with regards to the safety messages on the oils, hot oil fires, and also maybe some other 2 or 3 safety messages as well. If you wish to, I'm more than happy to put them in touch with yourself.
I think that'd be very helpful, Chair. Thank you.
Thank you. Any more questions at all on item 10? If not, we'll move on to the verbal report, which is the fire investigation cases of note, and that's by Neil. So a bit of rest for you, Scott.
Thank you. I'll try and bring this report up now, so bear with me, councillors.
Okay, Neil Griffith, thank you. Are you going to do some screen sharing with us, or?
That's what I'm attempting to do that now, councillor. It's
scroll down, Scott. Yeah, there you go.
Are you able to see that?
Yes. Full screen, they should be able to go on to the slideshow.
Cheers, thank you. Good afternoon, everyone. Can you hear me okay?
Yes, we can.
Yeah, okay, right. My name's Neil Griffiths. I work full-time in the Fire Investigation Department. So Scott's just asked me to come along and give you a quick presentation on some cases we've had over the last 12 months that have resulted in some successful convictions. Okay, so just to give you a bit of background information, in 2019 we issued 48 what we call Section 9 expert witness statements. And these are statements supplied to the police to help them to secure a conviction. So where the accuser's not pleaded guilty, the fire investigation officer may be requested to give evidence in Crown Court to achieve a successful prosecution. We've had to do this a couple of times over this year. Well, I have anyway. So of the 48 cases that we supplied a statement for, West Yorkshire Police Witness Care updated our officers on the progress of 13. And the reason for this is that the fire investigation officer may have been required to attend court and give evidence. So not all of these 48 cases have been progressed to court, basically. So from these 13 cases, we've had 15 individuals that have been or are currently being processed by the Crown Prosecution Service. So a summary for 2019 then, as we've already stated, 48 Section 9 expert witness statements. We've had 14 cases whereby 18 individuals have been charged with an offence relating to arson. 11 convictions to date of the 18 individuals charged. And the convictions at the moment are totaling 147 years, 10 months and 2 weeks. With one person detained without limited time. So that's pretty good going for the last 12 months, isn't it? So I'm going to show you 3 quick case studies that we've had over the last year. The first one occurred in Huddersfield on the 17th of June 2019. When the crew arrived, they were confronted with a well-developed fire in the rear external porch of this property, which is what you can see here. The fire had burnt through the roof. Flames could be seen reaching up to the first floor. The next door neighbour told the crew that they thought the occupant, which was an elderly disabled lady, was trapped inside, and the fire had started spreading into the house. So firefighters wearing breathing apparatus entered the building and found the occupant in the dining room, which is the window to the right in this picture. Now, the occupant had mobility issues and slept downstairs in this dining room, which had been converted to her bedroom. So the doors from her bedroom to the kitchen and from the kitchen to the outer porch, where the downstairs bathroom was, had been removed to facilitate her movement around the ground floor. Unfortunately, that resulted in the kitchen and bedroom being quickly filled with thick black smoke. So the crew stated that the smoke was almost down to floor level when they entered the building, which greatly reduced their visibility. They found the occupant on her bed and carried her out of the house where an ambulance was waiting. She was rushed to hospital, but unfortunately she died of her injuries about a week later. Right. Oh, yeah, sorry. Just bear with me a second. Right. figure it out, so that's all right. So I carried out a detailed examination of the fire scene and discovered that the fire had started in an inside area to the porch. We fully excavated this area and removed one layer of debris at a time. Any items of note were documented and photographed. I found the inner and outer frame of the porch, and the inner door frame was in the lock position. The outer door frame, which we can see here, was in the unlocked position, meaning that anybody could have accessed that area. So police found a CCTV camera on a building opposite the rear entrance to the house, and when they examined the footage, it showed a figure leaving the drive of the house. Shortly after the figure left, flames were seen coming from the inside of the porch. So about an hour later, this fire occurred in an outbuilding attached to a house in Mirfield, about 3 miles away. This was investigated by one of my colleagues and found to be deliberate as well. We found some CCTV covering the door of the house, and we found the same figure from the last fire, leaving and entering the house shortly afterwards. Flames were seen. So the police managed to positively identify the person and made an arrest the next day. So statements were provided to the police by myself and my colleague, stating that both fires were deliberate. And the statements, along with our notes and photographs, were submitted as evidence for the Crown Prosecution Service. Myself and my colleague were both summoned to Leeds Crown Court to give evidence. The accused was found guilty of manslaughter, arson being reckless as to whether life is endangered, attempted burglary and possessing an article with a blade, and a custodial sentence of 18 years and 6 months was given by the judge. So that was a successful one there. The second one we're going to look at was a serious house fire that occurred in Heckman-Wyke in the early hours of the 11th of August 2019. There were 4 people trapped inside the house at the time of the fire, and 3 of the occupants escaped and 1 was rescued by the fire service. So the fire completely destroyed most of the inside of the house, and it started in the hallway. The windows in the attic were open at the time of the fire, and that provided ventilation for the fire to spread quickly, trapping all the occupants in their bedrooms. So one of the occupants was in the attic bedroom, and he saw flames on the staircase blocking his escape. So he was left with no choice but to jump out of the bedroom window, which caused him serious spinal injuries. One of the other occupants was rescued out of the front bedroom by the fire service down the ladder, which is the window we can see on the left-hand side. The 2 other occupants, which were a mother and a daughter, managed to climb out of the bedroom window on the left of this picture and down the conservatory roof to safety. All 4 occupants were taken to hospital and treated for smoke inhalation. These next couple of pictures will help to illustrate how severe the fire was. This is all that was left of the attic bedroom. With the attic windows open, the staircase in the house acted like a chimney, drawing the fire upwards and blocking the family's escape route. Most of the internal walls were completely destroyed by the fire, and this is all that was left of the rear bedroom. So I determined the area of origin to be directly behind the front door. The front door had more or less completely burned away, and this would have provided even more oxygen to the fire, increasing its intensity further. There were no ignition sources in this area that could have caused an accidental fire, so due to the fire's rapid development, I suspected that the fire may have been started deliberately using an accelerant. Part of my initial findings was I found this cigarette lighter on the path which was next to the front door. So I started interviewing the neighbours to get their accounts of events leading up to the fire, and several neighbours stated that they'd heard a bang and saw flames at the front door. They also said they'd seen 2 people running away from the scene. So fortunately, the house had CCTV covering the front door, so I managed to recover the hard drive from the fire debris, and we handed it to the police. We discovered this footage of it. It's just a small clip, but it shows you exactly what happened. Don't think we're in any doubt that that was deliberate now. So we contacted Humberside Fire and Rescue Service and arranged for one of their hydrocarbon dogs to attend the scene. They're trained to positively identify accelerants and give us an indication of the best places to collect samples from. So they were also taken to the suspects' houses to try to identify traces of accelerant on their clothing. I assisted the crime scene investigator in removing part of the door threshold, which may have had residue of the accelerant underneath it, and this was sent to forensic labs for testing. So following this, 3 arrests were made following the police inquiries, and I provided a statement determining that the fire was started deliberately using a liquid accelerant. Again, I sent my contemporaneous notes and photographs as evidence to the Crown Prosecution Service to help secure a conviction. So that case was heard in Leeds Crown Court in January. One of the accused was charged with attempted murder and sentenced to 32 years. The other 2 were found guilty of arson, being reckless as to whether life is endangered. One was sentenced to 9 years and the other was sentenced to 6 years imprisonment. And just to finish off, I'm just going to talk quickly about this case. Although it was quite a small fire, we were called to it. It was in Brighton Street, Wakefield, about 6 o'clock on the 6th of September, after a neighbour had heard the smoke detector sounding and smelt smoke. Crews had had to break into the house and they located a fire in the basement and extinguished it. It was only a small one, but then they found a male slumped in the corner of the basement. Took him upstairs into the kitchen, and it was evident that he was deceased and that his injuries were non-fire related. So they then launched a murder inquiry. So we assisted the police with the fire investigation side of it. The fire itself was just a smouldering fire, which would have produced a bit of smoke, but very little heat and flame. But it appeared to be an attempt to conceal the crime. So I interviewed the attending crews to determine how the property was found and what had been moved during our attendance at the incident. I then assisted the police in compiling statements and sat in as a witness for when they interviewed the crews. I supplied a witness statement to the police commenting on the fire's origin, cause and development, and determined the fire to be deliberate. They made 3 arrests within 24 hours. The case went to Leeds Crown Court in January again. 3 people were arrested, convicted of murder. 2 received 27 years and 1 received a sentence of 21 years imprisonment. So that was just to illustrate how we can help to secure a conviction, even though it was a murder case and the fire was a small fire. And that brings me to the end of the case study. I'll take any questions if you've got any.
Some terrible pictures and scenes to see. Right. Yeah, some pictures there, but yeah, really, really good work. Really good work. Eventually to see what the culprits were. You know, you helped the Crown Prosecution System to get the conviction on the culprits. Can you all see me clearly? Because I can see the cameras blinking for some bizarre reason.
No, can't see it yet.
I can't see you.
No, we can't.
Can you see me now?
No.
Yes, yes.
Okay, thank you. It's the connection. Something wrong with the connection. Yes, we had Councillor Graham trying to ask the question. Councillor Graham, please.
I've got a flashing computer there, Chair, at the moment, just flashing away there before some of the main issues are there. We have stopped now. I've got 2 slides of you. The thing is that I'd like to raise here is where these incidents are of so damaging as regarding what they are portraying that. Would it be possible for the police tasking meetings that we attend be able to show these at the meetings, or would it interfere with the crime going to court on that?
None of those case studies it would interfere because they're all closed now. So,
and also, Councillor Graham, they are in public domain, aren't they? Or used by anybody else?
I just want to know if they would be allowed to go to a tasking meeting to show the partners in the meeting what damage this kind of arson can do to the people's lives and well-being.
I will anonymise them, Chair, and send them out to the group so that they can be shared.
Good idea. Good idea. Thank you, Councillor Graham.
Thank you.
Yeah. If it helps, you know, the partner agencies or, you know, with the police tasking group like that, I think, yeah, if they're anonymized, I think it'll be a good idea to share it with them, if it helps you.
The sound is deteriorating again, Chair.
Yeah. Can you all hear me clearly? There's something wrong with the connection here.
Yes, there's a problem occurring.
Yeah, it's getting better.
Okay, thank you. Yeah, any other questions or any comments or queries at all on the report?
No, Chair.
Okay. Thanks a lot, Neil. That was a good comprehensive report. I think we're back to Scott again, I think, and that's agenda item 12 for the performance against PMI targets 2019-2020 from page 95. Over to you, Scott.
Thank you, Chair. Hope you've had a nice break from my voice. Neil is very smooth. So this report is to inform members of the Community Safety Committee of the performance against our 2020-2021 performance outcomes. And the report specifically looks at the first half of the year. I've taken it from April up to October. As we've presented these papers before, I'll discuss arson, dwelling fires, non-domestic building fires, fire-related injuries, malicious fires, rescues, road traffic collisions, and total activity. I'll draw your attention to page 97, which is performance up to the 1st of October. However, hopefully you've all received an update this morning, which takes us up to today. And I will use that if councillors are okay, if you approve that, Chair.
Yes, please. Yeah, I'm okay with that. Is everybody else all right with that? Yeah.
Yep.
Yes, I'm okay with it, yes.
Yes.
Move it, Chair.
Right. So this is the performance as of this morning. As you can see, it's looking very, very positive for the service, and even in comparison to the one that will be in your pack, we can see we've had some real encouraging change over the last month. Arson is down on the whole by 6% under target, almost, and primary fires are also down by 15.5%. It's always positive to see that these types of fires are down, because the primary fire arsons in particular, of young people being out of the schools, which is where we typically see a rise through the summer holidays. It's really pleasing to see that secondary fires are now 2.6% under target, and even over the last month that has dropped from 2.7% over target. So this is an ever increasing trend, which is really encouraging to see. Our actual rescues are well under target, and the first blip we do come across is total activity, which is showing it's 4.9% above our target for the end of the year. However, as discussed before, we didn't change our mobilising between March and August this year, which has resulted in 500 additional mobilisations to false alarms. And this is what's causing this increase in total activity. However, the rate it is falling. We do believe that by the end of the year, we will be in green for total activity to show a real positive against our end of year target. Non-dwelling fires are another area where we thought that people are going to be spending a lot more time in their home through lockdown. And it's really, really very encouraging to see that dwelling fires are down 12.5% under our target. And obviously, we will say, and we can claim that a lot of this is down to the prevention work we have been given over the last couple of decades, really. The advice is getting out there. Our social media reach is ever improving. So it's really pleasing to see that dwelling fires are currently under target. Also, in non-domestic building fires, this is probably one that is also quite closely linked to COVID. With less people in their workplaces of work, we are less likely to see ignition sources resulting in domestic building fires. The prevalence of false alarms is up by 9.6%. Again, this is ever falling, and we do think by the end of the year we'll be somewhere near neutral. And again, as mentioned before, this is because of our altered mobilising policy during the COVID pandemic, where because we were uncertain if people in the workplace who would be able to raise the alarm if there were a fire, we did mobilise fire engines instead, just as that security net. Fire-related injuries are down, 20% under target almost, and also road traffic collisions are looking very, very healthy. But again, linked to COVID, we are seeing less transport on the roads, which has contributed to that. And the final one, malicious false alarms, also 20% under target. Very, very encouraging right across the board. And if we continue this way, the 12-month target should be very, very positive. There we go. I do then go into district breakdowns through Wakefield, Bradford, Kirklees, Calderdale and Leeds. Obviously, due to the smaller data sets in these areas, small incident numbers do have a much more visible impact on the figures. But what is consistent through the districts is that prevalence of false alarms are up because of the mobilising, and total activity is slightly up. However, what we do expect is right across the board, they will come down by the end of the year. I'm happy to take any questions, Chair.
Can I get on mute, Chair? Councillor Almas, I think you're on mute if you can hear us.
Oh, sorry. Yeah, sorry. I was advising everybody to do that, and I forget myself. I think that's the biggest. I think that's the biggest, if you like, slogan of 2020 is unmute yourself. You know. Yeah, so going to Calderdale district, and I totally appreciate. Obviously, the sample is relatively small, and obviously with the lockdowns and various stages in terms of COVID, have really impacted the figures, especially vis-a-vis road traffic collisions and so on. So we can appreciate that. But going to Calderdale district report, malicious false alarms 58% above, 30% above on the prevalent false alarm, 21% on fires and arsons. That's compared to others, it's quite significantly high compared to the other districts. Is there a particular reason for that? There was some particular activity or incidents, or
Yeah. If I may, Chair, I haven't supplied all councillors with the local updates in terms of their performance management indicators, but just to give you a picture of where we are at today for Calderdale. So in arson, in your pack, it currently says 10.3%. As of today, that's actually down to 5.7%, which brings it into amber. And if we continue to see this decline, I fully expect that we'll be performing well within target by the end of the year. That trend is also echoed with secondary fires, which is currently also down at 1.7%. So again, the rate that's falling, I do expect that by early next year that will be well within our target. And then the other ones I'd like to speak about are actual rescues are also coming down. Total activity in Calderdale, in your pack, it does say 17.9%. We're actually down at 13.9%. So although it does look a little bit colourful in the pack that I've presented you, I can assure you that they are moving in the right direction. So I don't think it'll be looking like this within the next 3 months. The other thing, the malicious false alarms, we do set a very, very tight target for Calderdale on malicious false alarms. And very small numbers do set it over. We have had one problem individual operate within Calderdale, and we are working with local authorities and the police around managing that individual. It's just taken us a little bit of time. And one of the reassuring things about malicious false alarms are, yes, they are difficult. We don't want them, and it does take a resource. Fortunately, you know, we do have other resources present, so it's not somebody's life at immediate risk. We can always redirect appliances if required. So yes, we don't want malicious false alarms or hoax calls, but these are ones that if we were going to have a spike across any of these areas, that would be the one I prefer, I think.
Yeah, I mean, I would really appreciate in these reports for future, if there is a pattern in terms of repeat, if you like, offenders or somebody who's doing it maliciously. For example, if there was, I don't know, 12 incidents by one individual, can we not separate that, or, you know, sort of multiple incidents by 2 or 3 individuals who were doing it again and again? Then at least we get a picture in terms of, you know, X number of that. Obviously, it looks really, really bad, 58.7%. But putting things in perspective, if we know, you know, 8 of those were done by one individual, or 6 and another 6 were done by another individual, it really impacts the entire figure. But put things in perspective. Don't you think it'll be a good idea to do that in terms of the actual report?
I can certainly make that more explicit with the commentaries, Chair.
Okay, thank you. I've got Councillor Pollard asking the question, please. Councillor Pollard, go ahead.
Thank you, Chair. Yeah, I did actually raise this point at the pre-meeting briefing we had a week or so ago, but it strikes me that the effect of COVID this year has so skewed the overall figures, especially in areas such as road traffic collisions, that I think presumably we're going to have to radically rebase the figures for these performance management targets next year, because the 3-year average basis is patently going to result in some very severely skewed figures in some areas. Have we now given some serious thought to how the PMI system is going to be rebooted, so to speak, for 2021?
Very good point.
We are considering a number of options for this, Councillor. As you say, it's not the easiest, and what we don't want to be accused of, it obviously very much, we don't want to be accused of fudging the figures. So we are looking at options that will give you the best ability to challenge us on our performance, but also reflect what is actually happening around the county. So although we're not there yet with it, we are working towards a better system to be able to give you something going forward.
Okay, thank you. And that is hopefully by 2020 that we return back to normal as well. However,
yes, absolutely, yes.
Yeah. However, if we have similar sort of things happening, maybe in the first quarter of 2021, we'll be in a similar boat again as to how to adjust them kind of figures. Hopefully not. But yeah, let's pray for the best and prepare for the worst. Yes, Councillor David Curtin, please. Councillor Curtin.
Yes, thank you. Yes, thank you, Chair. Scott's already answered some of my questions that I was going to ask. Clearly, when I looked at the Calderdale district, almost covered in red, I was extremely shocked to see that, especially, you know, the issue around the malicious false alarms and the fact that it's down to one person on page 111, you know, and I was just wondering, you know, what we were doing to try and sort that out with the council. But the other question that I've got is also on page 112, the last page there of Calderdale, and that is the borough market there and the number of false alarms within the borough market. And I was just wondering or querying, how are these false alarms being activated in the borough market, and do we know who's doing them, and, you know, and how is it happening?
Thank you, Chair. Thank you, Councillor. We do monitor false alarms very, very closely, particularly the malicious ones, because we do have a charging policy where if we feel that either the location isn't taking enough responsibility, such as they're not maintaining a system or they're not protecting their false alarms, we will look to charge for our attendance after multiple malicious false alarms. The borough market in Halifax is one that we have been looking at for a very long time. We also have very, very close working relationships with Calderdale and the local authority there, and there's no insinuation whatsoever that they're not they're not acting responsibly. The managers of the borough market do all they can, but as you can imagine, with the footfall that they do get through there, the multiple entrances, the cross section of the community you get in there, it is very, very difficult for them, and they do tend to be through break glass actuations as well. Through the very, very nature, we do have to make break glass alarm systems available to people. So obviously, if we were to cover them or make them and put them in inaccessible areas, we wouldn't be fulfilling our fire protection duties. And with it being such an old building as well, it's difficult to bring in more modern systems. So we are trying to reduce the numbers with the borough market, but there are a number of challenges there which are slowing us down.
Okay, thank you for that. Thank you for that, Scott. Thanks, Chair.
Thank you, Councillor Curtin. Thank you, Scott. Any other questions or comments at all? Okay, thank you. If not, we're going to move on to agenda item 13, which is the Grenfell update. Now, this particular item is divided in two parts. Part one is the briefing, obviously from page 21, as all of you have got. And part two of that is going to be a members briefing session, which is going to be after this. So please stay online after we've gone through this and any other business. You know, there will be a full members briefing session afterwards. So may I ask you to stay after we've gone through even any other business, not to leave the room, and then we'll go through the training. Thank you. Over to you, please. Is it David? Please.
Yeah. Good afternoon, councillors. It's Area Manager David Teggett here. So obviously I'm going to run you through the paper. As has just been mentioned, there will be a closed briefing after this. Once I've completed this, if you want to ask me any questions, by all means, please do so. So obviously the report provides an update on where we are as a service. I can draw your attention to section 2.4, which starts on pages 119. That identifies the key areas that the action plan is undertaking, and it provides a short update into some of those areas. Now, clearly, I'm not going to go into a great deal of detail on all of those. However, we are reviewing and amending series of guidance and our policies and procedures. The outcome of that is updates to equipment or purchase of new equipment, and we are delivering a significant amount of training to our staff. Over the last number of months, we've provided tabletop exercises to all staff across the service. We've done some specific CPD sessions with our FDS officers who will be in charge of larger incidents such as a high rise should it occur. We've done some more specific briefings with all our operational crews with regards to exactly what happened at the Grenfell Tower, some of the decisions that were made and some of the things that happened on the night to try and tease out some learning for our operational crews such as BA, wearers and the likes. Moving forwards, COVID dependent I may add, we will be undertaking a series of live exercises. We do have some high-rise buildings within the Bradford district that will shortly be knocked down. The owners of those, and we are working with the actual demolition company as well to ensure that we can use those for a period of time to provide some live training for all our staff moving forwards. We've also created a number of specific work groups and forums, some of those being internal, some being external, which includes sort of colleagues from local authorities, housing providers, and we are working across the region within the Yorkshire and Humber Operational Resilience Group with a group of serving members from across that area there. I also sit within one of the NFCC, so the National Fire Chiefs Council, working groups that is looking at a variety of areas around high-rise residential building, firefighting, and some of the things that we as a service nationally need to update and move forwards. Sections 2.5 to 2.12 look at the buildings with unsafe external wall systems. We currently have approximately 60 buildings within West Yorkshire with a variety of different issues. If you recall, when we first started, shortly after the Grenfell inquiry, everything was looking at ACM, so aluminium composite materials. Since then, the world has moved on, and we now understand that it is not just ACM. There are other items such as what we call HPL, so high pressure laminate, but a variety of other things. So that will include the likes of balconies on the outside of buildings, or timber, and many other things, including insulation as well. Section 2.11 on page 121 identifies the new updated guidance on simultaneous evacuation. So that was released on the 1st of October. That is a joint document that is led by the NFCC, but also now includes multi-agency partners from a variety of areas throughout both sort of private and national government. That now shows that if a building has some type of unsafe external wall systems, that they need to consider the installation of common fire alarms. They also need to understand what a waking watch does or doesn't do, and the difference between what a waking watch is and what the evacuation management needs to undertake. It also emphasises that in some cases, residents within those buildings can undertake the role of waking watch and evacuation management. Now, obviously, there has been quite a significant amount of information out in the public domain regarding waking watchers, the cost and those sorts of things. So that updated guidance significantly changes the approach that people should be taking. I will provide a lot more detail on that later on in the private briefing. Sections 2.17 to 2.21 on pages 121 and 122 identify some of the legislative changes. I won't go into them, they are listed in there. And then section 2.22 and 2.24 provide a short summary on where we find ourselves with the phase 2 Grenfell proceedings. It's recently had its summer recess and has once again started resitting. And obviously within the media we are seeing regular updates from what's happening within the that actual process. Moving into section 3, obviously that provides the financial implications, and then moving on to the report, how that fits within our organisation's objectives and so on. I'm now happy to take any questions from any members should they wish to have any.
Any questions at all at this stage? Because we're going to go into the members' briefing. We're going to get a full brief anyway. Yeah, Councillor Pollard.
Yeah, just a very brief one, really. On section 2.5 on page 120, what's the specific issue with balconies?
So a balcony on its own doesn't create an issue. However, what we have found, particularly in newer buildings, that balconies are being designed with timber floors or potentially timber facades around them. So unfortunately, the material it's built of is the issue.
Thank you, that's fine.
Thank you. Councillor Ronald Graham, please. Councillor Graham, I can see your hand.
Thank you, Chair. A bit quick on this before I go into private session. My main concern is the responsible persons that the Chief Executive identified as a need and a requirement around the estates of all of West Yorkshire, Chair. And then I'll bring up the other stuff in the private session, Chair.
Okay. Yeah, would anybody like to respond to that? Comment?
Thank you. I'll take that on, Chair. It's Dave Walton. We are in communication, particularly following the publication, most recent change, most recent guidance, with all of the responsible persons. Have to report that on the whole, the working relationship with them is good and effective. And we are dealing with those where perhaps information isn't as forthcoming as it may have been. But broadly speaking, I think we are satisfied with the working relationship with responsible persons at the moment.
Okay, thank you.
Can I come back, Chair? Just a quick one, Chair, before you move off. The question of responsible persons, I would like to see the West Yorkshire Fire and Rescue Service take up the role of the training that's required for these responsible persons, Chair.
Yeah, if I may, that does get us into some very tricky territory as the enforcing authority and potentially a training provider as well. So certainly we're looking at all ways of managing this particularly difficult situation that we have at the moment. But I do know your comments there, Councillor Barrett.
Thank you. I don't see any more hands up. If that's the case, any other business before we move on to the session members briefing? Any other business at all to discuss today?
Nothing from officers, Chair.
Okay, so if there's no other business, thank you very much indeed for all your participation, especially people who are watching us live and other people from the press and so on. So thank you very much. Have a very good afternoon. And for the members, if you could kindly